this session, we're going to explore how to solve some lateral hip pain, right? So what do I mean by lateral hip pain? Well, sometimes we can experience pain around this region of the pelvis. It can actually translate all the way down into the peroneals here and then down into the foot. The reasoning behind this usually has a lot to do with how we walk. Our gait pattern actually enforces a lot about how our body structures itself. It's the most active thing we do in a day unless we're involved in some sort of workout program. But even then, those mechanics play a part. And if we are misaligned in any way, shape, or form as we work through effort in that way, that's going to create a bias to one side of the joint or the other. I'll show you what I mean. If we load through the foot with a bent knee, what we're looking at here is how well does the ankle and the tibia absorb load, right? So if we think about bottom to up as the way the body processes most of its proprioceptive information, which it does, we want to establish how well the ankle joint and the knee joint are actually doing their job before that information gets to the pelvis or the hip. We want to see how well does that tibia actually externally rotate and internally rotate without the hip needing to do all that job. So if you want to try that real quick, you can think about how well do I externally rotate, how well do I internally rotate without my femur doing all that work, right? If you start to squat down and you notice that your foot rolls out and your knee goes out, or your knee goes in and your foot lifts up on the outside, you might have a bias one direction or the other. In this session, what we're going to talk about is how to increase IR, internal rotation of the tibia, so that we're actually lining up the ability to bend the knee in a more appropriate or centered way. So the first thing we're going to do here is we're going to take our heel and we're going to bite that heel into the ground, okay? So we're biting the heel into the ground, placing the foot flat against the ground. It's almost like you're trying to press down and screw the floor away with your foot. So you're externally rotating, right? Externally rotating just a little bit as you grab and press down into the floor. Once we have that locked in, we've locked the tibia into a little bit of internal rotation. We're actively turning the femur out as the femur and the ankle stay static. This is our goal. So once we have that, we're going to come into our little split stance here. Most of the weight's on this right leg, and then we're just going to slowly floss that knee bend, pressing through that foot as we come up, not fully extending the knee, but lightly tucking the pelvis. Screw the foot in, come down, loading into that foot, keep the screw effort, hold that external rotation, and then press back up, tucking the pelvis, keeping that soft bend in the knee, just for now. Coming down, screw the foot in, press up, and then let's go ahead and lock the knee out and tuck the pelvis to get a full stand here. So there's a lot of mechanics in that we'll go into at another time of what's actually happening with the tibia when we go down and come up, right? As you do that, what you want to feel is you want to feel your heel slowly start to slide out or towards the lateral side of your body a little bit. And it's going to do a couple things. It's going to stretch out this muscle that runs from the foot up and through the calf here. And it's going to twist that tibia to the inside, stretching all the tissue along this lateral side. Another way to work on this is our video on the lateral hip opener that really targets this whole lateral side as well. This one actually works on the mechanics of it though. So I recommend doing that first, then coming back and then working on some of this specific tibial rotation mechanics to help cement and really show the nervous system that this tissue doesn't need to be as tight. Let's go and switch over to the left side. Let's try that for a couple of rounds here. So once again, we're in that split stance. We're gonna dig the heel in. So you're gonna kind of pigeon toe, pull the heel in, spread the toes out just a little bit, come up onto the ball of the foot, lining up that pelvis. Bend in the knee, and we're coming down, hitting a range, And then pressing up, tucking that pelvis, keeping the bend in the knee. Down, loading into that leg. Feel that calcaneus, the heel, pull towards the wall that way. Tuck the pelvis, press up. And one more. Coming down, torque it in. Press, and bring that knee back all the way, tucking the pelvis. So as we do this, we definitely run into a little bit of the danger zone. We're putting pressure around a joint that could be very tight, and we don't want to push that too far. So you have to listen to your body and find just a little bit of stretch sensation in that area, bending the knee ever so much. Listen to the signals that your body is giving you about where the tissue will let you go in a safe manner. It does no good, zero good, to push the tissue farther than it wants to go. Tissue around the knee is very avascular. So it's not like we're stretching a muscle here. I mean, we are stretching muscles, right? Because they connect via ligaments to the bones. So we are pulling on the muscular tissue there, but we're also stretching the ligaments and the tendons. And because that tissue is avascular, it doesn't get as much blood flow. So it takes a lot longer for that tissue to respond to the stimulus that we're giving it. And if we try to push that tissue too far, it can become inflamed, and we could put ourselves into a world of hurt that we never intended when we're actually trying to make ourselves better. Faster is not better. Slow, controlled gets you to where you want to go. So as you work on these exercises, which you can do off and on throughout the day, and I highly recommend doing that because the more input that you put into it, the more your body is going to respond to it. But when your body says it's done, it's done. So listen to that and don't think you can make it do more than it wants to do. That's my advice for the day.